Okay.
Brad Olson, informative speech. Anemia is one of the most overlooked symptoms of disease since it is frequently mistaken for fatigue. There are many types of anemia, most of which are caused by other diseases, such as rheumatoid arthritis, kidney disease, cancer, liver disease, thyroid disease, and inflammatory bowel disease. Anemia can lead to serious complications if left unrecognized. So what is anemia? According to the National Heart, Lung, and Blood Institute, the most common symptom that defines anemia is when a person's blood does not contain as many red blood cells as it normally should. Another symptom that defines anemia is when someone's blood lacks enough hemoglobin, the iron-rich protein that allows red blood cells to collect oxygen and give blood its red color. What causes anemia? According to Edward E. Morris in his World Book Encyclopedia article, there are three major causes of anemia. The first is lowered production of red blood cells where the hormone erythropoietin is not produced. Common anemias of this type are iron deficiency anemia, vitamin B12 deficiency anemia, folic acid deficiency anemia, aplastic anemia, and anemia of renal disease. The second type is probably the most common, since it is extreme blood loss, which can come from open wounds and not so obviously a stomach ulcer. The third type is referred to as increased destruction of red blood cells. Since red blood cells are active cells, it makes sense that they would eventually lose energy and die off. However, this cause of anemia is when red blood cells die much faster than they normally would. It's typically caused by the disruption of hemolysis, the process where bone marrow produces new red blood cells. This disruption is typically caused by hereditary diseases and can lead to hemolytic anemia, sickle cell anemia, and thalassemia. Diseases that can lead to anemia would be for the iron, vitamin B12, and folic acid deficiency anemia would be cancer and hereditary diseases. They can also be caused by taking non-steroidal and anti-inflammatory drugs in excess. Anemia of chronic disease is commonly related to cancer, HIV, AIDS, rheumatoid arthritis, and kidney failure. Aplastic anemia is frequently related to infections and autoimmune diseases. And anemia associated with other anemias associated with bone marrow disease. These are commonly linked to leukemia and myelodysplasia. The common causes of anemia include, for iron deficiency anemia, it's caused by menopause on occasion and poor diet. Folic acid deficiency anemia is found when one does not take in enough folic acid, typically caused when vegetables are overcooked. Pernicious anemia is caused by hereditary disease and autoimmune diseases. So, is there a cure? According to the Society of Hematology, most forms of anemia can be cured depending on the cause. The deficiency anemias can usually be cured by a change in diet, but in more extreme cases, they may require a vitamin supplement. Other types of anemia that are caused by diseases can be cured by treating the initial disease. Other treatment options are slightly more complicated. Aplastic anemia, a form of anemia caused by a condition in bone marrow, requires tests through a biopsy to discover the exact form of aplastic anemia. If need be, the patient may require blood transfusions or even a bone marrow transplant. Anemia is a dangerous disease. Luckily, doctors have found a way to cure or alleviate most types of anemia. anemia is ultimately not a very difficult condition to live with if detected early and the type of anemia is determined.
Fantastic.